So good afternoon, everyone, and welcome everyone to today's NIHR first seminar on the use of routine data in evaluation of public health interventions. And it's really great, as people have said in the chat, to have so many people on the call today. My name's Emma Halliday. I'm a co-lead for the PHIRST LiLaC team based up at Lancaster University, and I lead the team with my colleague Ben Barr, who's based over at Liverpool University. So what I'm going to do is just do a really quick introduction to PHIRST, and then we'll move on with the main speakers for the session. So let me just share my slides. So as I said, for anyone, so there may be a few people today who are less familiar with NIHR and PHIRST. So I'll just very briefly explain what these terms are. So NIHR stands for the National Institute for Health and Care Research, and as a funder, they support a major portfolio of health and care research, and that includes public health research. And PHIRST, a number of people on the call may have worked with PHIRST teams or received support for evaluations. But if not, PHIRST is a responsive evaluation scheme and has a particular focus on supporting public health evaluations in local government settings. So it's well accepted that local government organisations, through their work across different policy areas, play an important role in addressing health and health inequalities. But often there have been missed opportunities to capture this evidence base in these settings. And that's where initiatives like PHIRST come along by supporting evaluations of promising interventions and schemes with public health relevance, particularly across the social determinants of health or particular services and initiatives that public health teams in those settings have commissioned as well. So PHIRST LiLaC is one of currently eight PHIRST teams. There is a process for requesting support from PHIRST teams, and the purpose of today's session is not to go into detail about that. But in short, the initiatives that PHIRST teams end up evaluating come from ideas submitted by local government organisations, and that's an open call that's put out by the National Institute for Health and Care Research. And a core principle through that process, and I think we'll sort of hear about through today's presentations as well, is one of kind of co-production and joint working with members of the public and also partners in local government. So this slide just provides most of the information that you need to know if you're wanting to be kept up to date about what's happening in the PHIRST programme, or if you just like to go onto our website and browse the range of evaluations that have already been completed or are currently underway. I think probably the only point to clarify in this slide is that there are usually 2 calls per year in September and April where local government organisations can submit a request for support, but that's slightly different in this round, where I think the next call will be out in early 2025, but perhaps Anne or anyone from NIHR who is on the call today could perhaps confirm that in the chat. So as I mentioned at the start, the PHIRST LiLaC team are hosting today's webinar. PHIRST LiLaC are a collaboration between Liverpool and Lancaster universities. And like PHIRST, we work closely with practice partners and members of the public who are part of our management structures. And we have a particular interest in looking at research around social determinants of health, and also a strong focus as well on health inequalities. In terms of the current and ongoing projects that we currently support, we have a growing portfolio of projects since getting going in 2022, and that covers a range of topics from welfare schemes to trauma-informed pilots in schools, as well as housing and planning initiatives. And like I think other PHIRST evaluations, alongside collecting data ourselves, perhaps through qualitative research, a lot of our studies as well tries to make best use of routine data sources available from local government or other organisations, as well as national data sets as well. And that really sort of brings us on to the point of this seminar. So why a focus on routine data? Well, one practical reason as PHIRST research teams that our studies need to often mobilise quickly and be responsive, or our studies which are completed in relatively short timescales. So routine data can be a really important source to help support an assessment of an intervention or provide insights into how to deliver and target public health interventions. So today's seminar really is about sharing some of the ways that we're doing that already across the different FIRST teams. So we have FIRST Fusion and FIRST Insight here today, as well as a presentation from FIRST LiLaC. And I'd also encourage you to go online and read the blog around using routine data to evaluate local government public health interventions, which has been produced by FIRST Connect and FIRST Fresh as well. And as this blog points out, as well as the opportunities that using data can bring, there can also be some challenges, whether that's related to quality, consistency, or availability of data. And we'll explore some of those issues today as well, and also hopefully touch on some of the challenges. Anne, I think, has gone through most of the housekeeping points. For anyone who's joined since then, I'll just remind people that because of the large numbers of people on the call, we're keeping people's microphones and cameras switched off. That's with the exception, obviously, of speakers and other contributors who've been invited to take part in the seminar. So please use the chat function to ask questions. We'll take questions after each presenter, and we'll try and get through as many of those as possible. We'll also stop for a short comfort break around, I think, just after the second presenter, but we'll start really promptly after that to keep things to time. So I think without further ado, I'm really pleased to introduce our first speaker, who is Peter van der Graaf. Peter is a member of FIRST Fusion and works as an associate professor in the public health team at Northumbria University. So Peter, you're going to be speaking about a fusion-led evaluation of social navigators. What I'll do is stop sharing my screen so I can hand over to you to take over.
Many thanks, Emma. Just bear with me while I share my slides instead of Emma's. Right, can everybody see my screen? Is that working? Yep, okay, fantastic. So welcome everyone, great to see so many people here. That's really amazing, and hopefully we get a bit of a good discussion going even after the presentations today. So as Emma said, introduced me, I'm Peter van der Graaf. I'm an associate professor at Northumbria University, and I work as part of FIRST Fusion in the beautiful northeast of England. And we recently completed an evaluation with South Tyneside Council about their Social Navigator Service, and in that we try to sort of link national and local data that they had available through the service to get a sense of the health and well-being impact of the service, and basically put a number and an economic figure on that. So I'm sharing some of the challenges today that we had in doing that, some of the reflections, but be really keen to hear your own sort of reflections if you worked in this way with local and national data. So just to give you a bit of background about the Social Navigator Service. So this was set up in 2021 by South Tyneside Homes and South Tyneside Council because they noticed there were sort of residents coming to them for support and returning multiple times without really improving their sort of financial circumstances. A lot of these residents experienced financial hardship and often presented with quite sort of complex additional health and social needs in terms of mental health, in terms of social isolation, disabilities, and they were keen to support those. So they developed this service as a way of trying to help those people better, and they recruited 4 social navigators who have basically an outreach role. So they reach out to these service users and try to sort of address the underlying causes of financial hardship and work with them in a person-centered way, but also trying to be a bit of a boundary spanner in the local service provision and knit different services across the council together. So what we did initially as part of FIRST Fusion is work with local stakeholders to develop a research protocol to work out what their evidence needs is, and we used availability assessment workshops to do this. And together we came up with an aim around trying to explore and quantify what sort of the health and well-being impacts were of the Social Navigator Service, with a view of helping the service to recommission itself, present a good business case, but also how could it be developed further in the future. And we did this through 3 different work packages. The first one was trying to make best use of available service monitoring data, and then complement this data with more qualitative follow-up interviews with some of the service users about their experiences and outcomes. And we trained some of the social navigators as peer researchers to do those interviews, sort of to have a bit more of a bottom-up approach, provide sort of an authentic voice to the research, but also very practically, because those service users felt more comfortable with the social navigators, had a trusting relationship, and were more keen and able to share their experiences with those social navigators. So we provided them with training to do this, and then we tried to bring that together and complement the local data through those two work packages by doing a social journal investment analysis, accessing data from the UK Social Value Bank. And this is a data bank set up by a charity, a social housing charity, combined with a research consultancy, who've developed this database in 2014 and use a lot of national service data and to use that data to model the social value of different indicators. And I will explain in a bit more detail what that looks like and how we've tried to use it in our research. So just to sort of start with a bit of insight into the service monitoring data that we had available, and that we analysed sort of descriptively to get a sense of the population that they were serving. And what you can see for some of the bullet points here is that the population was mainly female, sort of working age 30 to 60, and many of them were not in employment. They were either unfit for work or they were unemployed, and they had an income of less than £10,000, for 63% of them. They also presented, as sort of mentioned, with sort of health problems. So 81% report at least one health problem, but on average people had multiple health problems, with mental health being the most common, but also other problems about long-term health issues and disability. So this highlights a vulnerable population and challenges of engaging with this population for the service. We also then, sorry, I'm scrolling a bit too quickly. Here we go. So one of the things that was in the data, I think I missed a slide, so I'll quickly go back. This is the one I've missed out, so apologies. Just to outline what was in that sort of service monitoring data that we started to look at initially. So this was data that was collected by the social navigators at sort of intake. So when clients started to engage with the service, they asked them a few questions, and then they followed up at midpoint and at the end of when they closed the case, which could be a long period or short period, depending on need. So there were 330 cases we were able to access between September 2021 and December 2023. And these were across several spreadsheets that I had on the online system. So one of the first jobs we had was trying to make sense of all these spreadsheets and put them together and link all the data across. The data that they were recording were some basic data about participant characteristics, as you can see in the bullet point, but also around sort of the financial gains that service users were able to access through the social navigators or the service that they referred them to. So think of things like child benefits, council tax rebate, food and utility vouchers. And we sort of categorize these different financial gains in two categories, sort of one-off gains and ongoing analyzed gains that they receive every year. And perhaps most importantly for us, some of the available service monitoring data was around what they called scored outcomes. So they collected data on 10 outcomes related to the confidence of service users on a 1 to 10 LiLaC scale around, for instance, ability to assist or ability to ask for help, or ability to access advice, health and financial services, their ability to budget their income, and things around sort of their digital, social and employment skills. So this was sort of the initial data we had access to. So sorry, I jumped a slide, but this is sort of the population outline that we were able to get from that data. And then we looked next at sort of the scored outcome data in terms of what can they tell us about the confidence and how that improved over the duration of the data that we had. So the outcomes are mentioned here. And what we were able to demonstrate, and maybe the first point to make, is that we lost quite a few cases already by looking at this data. So we started out with 303 and then 330, and only 130 participants provided baseline data and follow-up data on these 8 outcomes. So that's a point I will come back to later. But for the people that we had participants, we had data on, follow-up data on, what we were able to demonstrate is that they showed statistically significant changes across all these 8 outcomes, and particularly around sort of improvements in ability to ask for help, accessing advice and financial services. And you see in brackets of the points increase on average on those skills, with more limited gains in seeking employment and digital skills. So those were recommendations we could make to local authority for improving their access offer on that. And then we also used the financial gains. Apologies, I've got a bit of issue with my mouse. Yeah, it's working now. The financial gains that we were able to learn more about through the social monitoring data showed that almost 2/3 of the service users received a one-off financial gain, the mean was over £1,200, but this was actually highly skewed. So 50% of the service users actually only received a one-off gain of less than £180, with most common gains around sort of debt and energy related gains and accessing household support funds. Over a quarter was able to get annual financial gains, so get an annual repeat of those gains, slightly higher, about £1,700, and again highly skewed. So 7 users received over £10,000 of financial annual gains, while only 75% received less than 634. And then the most common gains here again are around access to social security, council tax support, and universal credit. Although these might seem small, they were really meaningful for the service users in the interviews that we did with them. And I won't report much on the interviews during this presentation, focusing on sort of the local and national data, but they really appreciated those small financial gains and helped them sort of relieve some of the debt burden that they were facing. But to reflect a bit on sort of the usefulness of the service monitoring data, local data we use, as said, there was a large amount of missing data and lack of follow-up data. We could only use closed cases, so where clients have gone through support and had multiple follow-up measures that we could use. Some cases only were introduced briefly, but then weren't follow-up or there wasn't any follow-up data collected. So we lost quite a number of cases in only being able to focus on the closed cases. And then again, if you look at the follow-up data, so about 86% completed baseline data, but only 113 to 56% completed follow-up data. So again, we lost quite a few number of cases in trying to look at the follow-up data, and particularly around ethnicity data, there was a lack of data. So almost under half of cases did not report any ethnicity. So that was another recommendation we made to the local authority to increase their data collection on that. So to address some of these gaps in the local data, we tried to combine it with national data. And what we did here is that we mapped the scored outcome data measures to something called the Hacked Social Value Calculator. And this is sort of the survey, the database I mentioned earlier, developed by the housing charity and the research consultancy, where they use a lot of national survey data. For instance, the English Housing Survey. They use the British Household Panel Survey data. They use I've got a list here. A number of data sets that they brought together, and they really were trying to isolate sort of what's the impact or the effect of a variable on an individual's health and well-being, and what's the equivalent amount in money that will be required to increase the well-being by the same amount. So they use a modeling technique with various algorithms, and I'll present some references at the end that you can look at to read in more detail how they've done that and how they use that national data to derive at those valuations. What we did, we accessed those valuations through the Hacked Social Value Calculator, and we're able to match 3 different scored outcomes to calculate sort of the social value. And then based on those social values, we're able to do a social return on investment analysis where we collect the ratio and average gain per person. So to launch straight in, this table sort of gives you a bit of an overview of what you see in the second column is the 3 outcomes, scored outcomes locally that we're able to match on the database, and the financial proxy that the calculator calculated for us based on the national survey data, but multiplied by the number of people that we had evidence for that there was an increase in that on those outcomes. And then the calculator also added a debt weight, so attributing for how likely was it that this outcome would have happened anyway, and therefore do we need to reduce sort of the impact of that. And that resulted in a net social value that is mentioned in the last column, and then we added sort of the financial gains were calculated to that. So that gave us an understanding of sort of the social value of those different outcomes. And from that, we were then able to estimate the costs of the service, mainly salaries, as you can see in the second column, compared to the social benefits and the difference between them. And that allowed us then to calculate an average gain per person and a ratio for that difference. In this case, that was almost 3 to 1. So for every pound spent, about £3 the local authority gained in social value with the service, which was a great business case for the local authority to help with the recommissioning of the service. So to briefly sort of summarize the findings from looking at sort of the local and national data and trying to combine this. So we were able to demonstrate there were significant changes across all the outcome, the 8 confidence outcome measures that were scored in that system, particularly around improving their confidence and access to advice and financial services, but more limited gains in seeking employment and digital skills. They were able to get sort of direct financial benefits and also annual financial benefits. And from the interviews, particularly, they highlighted, as I mentioned earlier, that this really helped to relieve their financial burden, and in doing so, improve their quality of life. So they service users told us they were becoming more able to leave their house and heat their homes, and really felt that that support they received improved their mental well-being. And if you want to know more about these findings, you can read in the report that I will set the link for at the end of this slide deck. And then we translated this into a social investment ratio of £3 for every pound spent, which was really appreciated by the local authority in helping to recommission the services. But in line with the theme for today, sort of using available national and local data, what we learned from this is that there's a large amount of missing data and lack of follow-up data at sort of local authority level. They've got a lot of data, but it's not always complete. So what we did is support the local authority to collect that data more systematically at regular intervals, and also make it a mandatory requirement for the social navigators who are collecting this data to add this data at the system at regular time points. And that should really help in future evaluations in looking at the data and using that data more thoroughly. I mentioned a mismatch between sort of the local data and the national data. So we were only able to match 3 of the 8 outcomes that were available to us in the local service monitoring data. So what we did, we advised the local authority on additional outcomes they could include in their service monitoring system to provide a better match, and also included a validated well-being score to help them achieve that better match. We reflected on the time intensity of the process of the collating all the different spreadsheets that were available on the system, and this is where the value of the embedded researcher came in that we employed, that was really able to gain sort of an insight in the key variables that they needed to use across those different spreadsheets, how to combine them better into sort of a core spreadsheet. So we anticipate that for future and follow-up evaluations that they're now able to do, they can access this data much more readily, and especially if it's more complete with the missing and follow-up data, have more rigorous data to build their analysis around. In that sense, the embedded research is also really valuable to ensure easy access to the data. So because the embedded researcher was from the local authority team, had direct access to the data, there was no need for a data sharing agreement, and they were able to update data ongoing during the evaluation. So the embedded research role proved really invaluable for sort of the data analysis that we were doing. So I would like to end with sort of a few quotes from the embedded researcher herself, who has been working on this, and sort of highlighting, I tried to include a photo of her, but unfortunately I couldn't find one. So I included instead a photo of an idealized picture of what a boundary spanner or knowledge broker should look like. And you can see various things here in the picture around walking a tightrope, balancing skills, providing emotional support and wisdom, and being a strong supporter and encourager. And in sense, the embedded researcher does all of these things. But in her sort of experience on reflecting on the available data, she mentioned sort of that benefiters really benefited from the peer research training, but it also showed them what they can do with the data that I have available, and how the data that they collect can be maximized. They now collected their follow-up data systematically after 6 weeks, and then every 12 weeks to the closure of cases. And to support this, they made changes to the case recording system, and that already increased the amount of data held on the characteristics of customers. So there's already difference being made to the to the monitoring data system that they have based on the research findings, including changes to the scored outcomes. If you want to read more about sort of Sarah's reflections on her work as embedded researcher and working with the data, there's an excellent blog post on the PHIRST website, and there's a link there that you can access to have a look at it. At this stage, I just wanted to say thank you. Ask for any questions. There's a few references here if you want to look at the final report or the paper that's currently under review. There's a few links to, so if you want to read more about the HACC database and sort of their methodology for calculating those well-being values, which I hope is useful. But last but not least, a big thank you to the wider research team here. They couldn't all be here, but they've been instrumental in this, and particularly the social navigators who act as peer researchers that Pritesh will mention at the end. So thank you very much for listening to this, and really keen to get your questions and insights on how this worked for you when you were trying to work with local and national data. Thank you. I'll stop sharing at this stage, if that's okay, Emma.
Great. Yeah, great. Thanks, Peter. Really, really interesting. I can see there are a few questions in the chat, and we've certainly got time to take 2 or 3. If LiLaC could kick off with those, and perhaps if there are any that we can't cover, you could respond in the chat to people as well.
Sure.
LiLaC.
So yeah, the first kind of question that came through, are these service monitoring data available everywhere, or were they specific to where you were working? And were they already collecting this data, or were they asked to as part of the evaluation?
No, so they're specific to South Tyneside. So they developed their own service monitoring data system, and sort of collected this data themselves before we started the evaluation. Hence, we could go back to December 2021. So this was specifically designed by the council and the service, and for that service. So in a sense, great that we didn't have to advise them on any sort of baseline data to collect. They already had this installed, but there were some issues with the way they were collecting it and how they were collecting it. So part of the evaluation was how can we improve that data collection. But it's, I think in my experience, quite unique to have that data already available from the service at the start of an evaluation. And I think it's a good example of what you can do if you incorporate that in your service development.
Thank you. And then there was just another couple. So were there any differences in engagement and outcomes between men and women?
Engagement in terms of the outcomes, or in terms of whether they were taking part in the service? I guess it's,
Sorry.
I mean, from the data that we have in terms of participants, that there was a higher female participation rate than male, which actually surprised the social navigators themselves, that they thought that there would be a larger male population accessing the service. But what we gained from the data is that it's a larger female population. In terms of the outcomes they experienced, we couldn't see any differences between males and females or significant differences in the type of outcomes they experienced.
And Amanda's just clarified, so it was engagement in terms of completing the data pre and post?
No, we didn't see any great differences there. It's well, partly skewed because we had a larger group of females completing the data than males, but we couldn't see any noticeable differences in completion of the data. So that attrition rate that we saw in terms of completed cases and follow-up data, there weren't significant differences there between male and females as far as we could see.
Probably just time for one more question later.
There was one that's just come through around how important was it to not need to request data sharing agreements, and how you managed that side of things.
That was really important, because in the past that has taken a long time and delayed sometimes projects for many months while we were waiting to get access to the data by organizing data sharing agreements and get them signed off both at the university end and the local authority end. So not needing that data sharing agreement because the researcher or the embedded researcher holding that data was part of the research team and therefore covered by the ethics from the university, that really speeded up the data collection significantly. So yeah, a big lesson for us to use that as a mechanism for future evaluations.
That's great. So I'm going to move on just in the interest of time, but there are a few other questions I can see in the chat. So if you'd be able to just go and have a look at those, that would be great, Peter, and we can also pick them up hopefully if there's time for discussion later as well. But thanks so much. So I'm really pleased to move on to the second presenter for today's webinar, Dr. Samantha Garay. Samantha is a member of First Insight and works as a research associate at Decipher at Cardiff University. So Sam, you're going to be talking about using routine data in the context of school-based programmes delivered in Scotland.
That's correct. So I'll just start sharing my slides now. Let this load. Well, so hopefully you can all see my slides now. You never quite know if it's going to work or not. So yeah, thank you so much for the introduction. I am Sam. I work in Cardiff as part of the First Insight team, and I joined this evaluation towards the end, and it's completed about April 2023, so last year. So I'm just going to talk you through the evaluation we did on the Mindset Teams program and how we utilised the routine data in this. So as I mentioned, this is a collaboration between the Mindset teams, what am I talking about? The First Insight teams, which are based across Cardiff and Bristol, as well as Win in Scotland, which is a charity based in Scotland who work with like-minded partners to build confidence and resilience in young people. Through their work, they aim to engage and empower individuals and groups who have the greatest influence on young people, such as schools, giving them the tools and knowledge to actually create sustainable impact. So one way they do this is through the Mindset Teams programme. And this is a 12-month school-based programme that's been delivered across Scotland since 2018. So at the time of the evaluation, it had been delivered to 25 local authorities and 572 schools across the area. And this is typically delivered to schools in the more deprived areas of Scotland. So the actual Mindset Teams programme, it's comprised of developing a mindset team within a school, and it's typically consisted of a member of senior management becoming a mindset leader, and at least 2 teaching practitioners who became the 2 mindset champions within the school. And they work together as a team to actually try to bring about a mindset programme into this school and work to improve growth mindset. So they did this over a 12-month programme, which involved both online modules as well as a classroom application. And the overall aim of this was to promote a growth mindset culture among schools and improve resilience for learning. So to give a bit more information, growth mindset is the belief that our abilities are adaptable and can be learned and developed, with the level of success determined by factors such as effort, application, and skill development. In contrast to this, a fixed mindset is the belief that our natural ability or our intelligence or talent are stable. So, for example, you could say, I'm bad at math, so I will always be bad at math. So this programme aims to develop this growth mindset within schools and sustain it after the programme is finished. This programme was delivered in both secondary schools and primary schools, but the particular focus of this evaluation was on the implementation in primary schools in Scotland. So what we aimed to do for this evaluation was twofold. So first of all, we wanted to evaluate the impact of the intervention onto the pre-specified outcomes. And then we wanted to look at the barriers and facilitators to programme uptake and delivery and a diffusion across of the intervention within and across schools. But the particular focus of the presentation today is going to be on the first aim as this relates to the routine data. So, as I mentioned, this evaluation took place in 2021, I believe it started, and it was a 21-month project that was co-produced with Win in Scotland. And this meant that we developed the key aims and the methods with them and made sure they were happy with everything that was going on with it. So, in order to address our aims, we utilised multiples of methods. We used interviews, and this was with both stakeholders and teachers, and this was to explore their thoughts and experiences of the programme, as well as their awareness of growth mindset. We also conducted focus groups with the children in these schools, and that again explored their experiences of being involved in the programme and the growth mindset learning as part of their lessons. The part that's most appropriate to this talk today is our use of the data sources. And in this evaluation, we used 2, which was the routine teacher survey data that was collected through through Win in Scotland, and the national data collected by the Scottish Government on school attainment and attendance. And we used all this data together to come to the conclusions of the impacts of the Mindset Teams programme and produce key recommendations for Win in Scotland going forward with this programme. So the teacher survey data, this was collected routinely by Win in Scotland as part of the actual programme. So teachers were required to complete an online survey both before and after completing the 12-month training programme. And this survey included 26 questions on general background, awareness of growth mindset, attitudes towards growth mindset, and how they believe the school delivery involved growth mindset. This was a mandatory requirement of the programme, and our particular evaluation focused on the questions related to awareness and attitudes towards growth mindset, and we utilised data from 2018 to 2021 that had been collected by the charity. On the other side of this was the national level data that we utilised, and this was school level data routinely collected by the Scottish Government. So it was available to access via something called Public Tableau, and this is available as a dashboard to the public. However, we reached out for access to the raw data spreadsheet so we could do the analysis from this. So I think anyone can go online and access this data if they want to in this form. So the data set we received included data on 2,056 schools with data across a 5-year period. And the data we managed to obtain was including annual average attendance rates, percentage of pupils achieving the expected curriculum for education outcomes, and these were specifically on numeracy, reading, writing, listening, and talking. And then we also obtained data on demographics such as school size, percentage of pupils with additional support, average class sizes, and Scottish Index of Multiple Iteration scores. However, due to the pandemic, there was no attainment or attendance data that was available for 2020, and this was linked to a challenge that will come up again later on. So in terms of findings, first of all, look at the teacher survey data. So we analysed data from 570 teachers who completed the survey before the intervention and 301 who completed the survey after undertaking the training. The survey, as I mentioned, required teachers to respond to various questions, and these were things such as these statements relating to attitudes towards growth mindset. And there were response options ranging from strongly disagree to strongly agree. In this particular case, this relates to attitudes towards growth mindset in pupils. And you can see these statements include things such as there will always be some students who simply won't get it, and some people have a knack for learning and some just don't. So the analysis revealed that what we found the impact of the intervention was that the teacher attitudes and knowledge of growth mindset improved after completing the training course, with a significant change in how teachers perceive the pupils' learning abilities. So there was a shift towards a higher appreciation that pupils can have different ways to get answers rather than just perhaps being taught it, and that there's a belief that all pupils can improve regardless of their baseline skills or motivations, and that ability does not actually remain fixed. And this was a significant change from what occurred before the intervention took place. And we found that basically these findings really did complement what we found through the wider methods we utilised in the study as well, such as the qualitative methods, in which we also found that taking part in the intervention actually enhanced teaching practices, improved personal qualities, and actually improved mental health. So it's kind of an example of how using routine data collected by the organisations can actually complement other methods that are utilised within these evaluations as well, and provide really rich data about the impact of the interventions. In terms of the national routine data, so we looked at the effect of the Mindset Teams programme on the national level school data that we received from the Scottish Government. And this included the outcomes of attendance, as well as the curriculum for excellence data for numeracy, reading, writing, listening, and talking. So the analysis consisted of schools for which all 4 years of the data were available. And of course, this had to exclude 2020, as due to the pandemic, as I mentioned, there was no data available for this year. This resulted in a sample of 1,220 schools, of which 72 participated in the Mindset Teams programme. So I will be honest, I didn't do the analysis for this, so please don't ask me any questions about this. However, you can find all the data on this paper that I've put on here. So our analysis basically showed that there were improvements in the curriculum for excellence outcome of writing among the schools taking part in the Mindset Teams programme. And specifically, 6% more children in the Mindset Teams schools achieved the expected curriculum for excellence level in writing compared to those in the schools without the programme 12 months post-programme. However, there were no differences found for reading, listening, talking, or numeracy achievements. And I come back to this point again in a second. So whilst there is very rich routinely collected data available for use in all these various evaluations and projects, there are a number of challenges that can occur while using them. So first of all is that it can restrict analyses, and this is demonstrated by the last finding I mentioned. So we only found an impact on writing and not the other curriculum for excellence outcomes on there. And we wonder if, because the data from the Scottish Government was collected at the school level, this also restricts the analysis to school level. And so any effects on classroom levels can be underestimated or actually not shown at all. So this is particularly relevant in the case of the Mindset Teams intervention, where in some cases the Mindset Teams programme was only being delivered in specific schools or classes and hadn't yet been diffused out through the wider school. And so, of course, we weren't able to really estimate these effects using this data. We believe if you had long-term follow-ups using this data, you would then see it when it diffuses more fully throughout the schools. But at the moment, these effects are probably going to be underestimated. Also, a really critical point that we came across is that this is administrative data that is not intended initially for research purposes, and so it's not research data. As such, you need to spend quite a bit of time getting this data into a format that is appropriate for research. So for example, in this project, we focused only on primary schools, whereas the data we were given was for all of schools in Scotland. And as such, it's of course necessary to go through and remove the secondary schools and special educational needs schools. Also, the data doesn't tend to come on the same spreadsheets, so you need to work across multiple sources to bring everything together that you might need. And these 2 points are made more difficult as schools and teachers were not given unique identifiers typically in this data, and this is something that is very necessary for research, especially when tracking across different years or using pre-post intervention data. Basically, it makes data cleaning very difficult as it is hard to identify specific schools across spreadsheets and across the years. So you can't easily go, oh, that's school one here, school one over here. You've got to really trawl through the data to find this. And this is particularly difficult when schools have the same names. So I believe my colleague mentioned that there was a case of, I think, St. Mary's School, and there were multiple schools with this name in Scotland. So you have to try and go through the data and really figure out which school is which. So this does make data cleaning a lot more difficult. And this lack of unique identifiers also meant that we could not do direct pre and post participant comparisons with the teacher data. And instead we had to do general cohorts, so whole pre and whole post analyses rather than looking at specific schools, because we just weren't able to identify these. The fact that this is administrative data rather than research data also leads to other challenges which are below, which include sort of the consistency of the data collected. So whilst you may have 5 years worth of data, that data is collected in ways that can differ across those years. So, for example, there may be instances of variables being added or removed as the data collection continues. In our case, we found that the national data we used for attendance was only collected every 2 years and not annually. So we had to restrict analyses towards this. And you may find that variables have been added throughout or taken out as interest increase or decrease in people collecting the data. It also leads to differences in the consistency of the data management. We found there were the consistency of the format of the variables varies quite considerably, not only across the years, but also within the same spreadsheets. So you can have some variables that use ranges, some use percentages, there are others that use numbers. And we also found that there were differences in data formats between the online dashboard and the actual raw data spreadsheet we received. I think the one instance was online, it gave you a percentage of attendance, and on the spreadsheet, it gave you a range. So that those challenges, all of these can be solved, but it just needs to you need to be aware of how these can actually impact analysis and research plans and really take into account how you're going to move forward with this data. Some key considerations to do this, and in light of the challenges, it's how you kind of get around and continue with the evaluations, is to really start considering sources very early that you can use in your evaluations. So have very, very early discussions with your team members and people you're collaborating with about not only what is possible, but actually what data is available. We found out through discussions with the wider team that this data was available in Scotland, and we found this at a very early stage, so we're able to incorporate it quite early. And this means that you're able to start establishing really good relationships early on with people who control the data, so you can start accessing it when you need it. As I mentioned, early access really, really is key with using routine data. Given the challenges that arise, you really need to maximise the time you have with this data. Access can take a long time to come through. I mean, this wasn't the case in this project. I think it came through a lot earlier than was planned, but typically access can be a bit of an issue. And Peter mentioned about the data sharing agreements and stuff, and that is something you've really got to take into account. That wasn't an issue with the national data that we use for this because it was publicly available, but it can be an issue, especially with the local authority partner data, if you may want to use that. A key factor, again, is to allow plenty of time to work with the data. You may not know the condition of data sources before you receive them. As I said, it was admin data, not research data, and it can take a very long time to clean this data and put it in the format that is required for research. So you really want to give yourself enough time to be able to do that properly. And finally, it's important to be flexible and to be prepared to adapt your plans to reflect the availability of data. So you may not know exactly what data you're receiving or the format it's going to be until you actually receive it. And so you may need to adapt your timelines and statistical plans to reflect this. So overall, these data sources are invaluable. There are many, many of them available that you might not realise, and this is at both local and national levels. It's really important to be able to integrate these into your evaluations. As I said, we integrated this with our interviews and focus groups that we conducted within school staff and wider stakeholders, and it really enhanced our findings to be able to do this. But my take-home message from all this is just to allow plenty of time to do so to make sure you can do it properly. So if you want to find out more about any of the stuff we talked about, this is our link to the first page where you can see our various outputs and our papers. And yeah, just thank you to everyone that was involved.
Great, thank you, Samantha. I can see a few questions popping into the chat if I hand over to Layla, but also some possible sort of ideas for resources that would be quite useful as well, I think, for people. Layla, what do we have in terms of questions?
So the first question we have, it sounds like you came across the fun challenge of working with these data. So how much did you underestimate the time it took and the skills needed to wrangle these data into the correct format?
I think so. I wasn't the person who was directly involved in this, but I've heard all about it from them. Basically, they weren't aware of the condition it was going to be in when they had it. It took a very, very long time to try and sort it out, but they had access to it many months before they thought it was going to happen. But this was an ongoing thing throughout the whole project. It took months and months of time to try and clean it all, sort it all out. And yeah, it wasn't anticipated that it'd be, not that it was in a really bad condition, it's just not in the condition you really need for research. So you just need to spend quite a bit of time with the formatting and changing of it. And just allow a lot more time than you think to do so.
Thank you. And then there's a couple more that are kind of linked, I guess. And it was, are you planning to document these findings around the data quality issues? Because it would be really helpful for others in the future. And do you have a checklist that people can use with challenges and just to help people kind of, I guess, think about them in advance?
So in terms of the challenges, we haven't actually put together a checklist of yet, but actually that's a really fantastic idea, and that's something I could take back to the team afterwards. I think that could be something done across the whole FIRST scheme, across the programmes to actually develop something like that for this data. In terms of bringing together all the various learnings from this, I think that's a really fantastic idea. There has been talk of bringing together a lessons learned sort of paper after all this with the rest of the teams in Bristol. So yeah, that would be something that we'd really like to do to make it available to other people.
Great, thanks. And perhaps picking up on the checklist idea, it's just to direct people again to the blog by the by sort of other FIRST teams, which has been produced in conjunction with the seminar, and maybe there's an opportunity to do a follow up, which goes into some of the kind of practical checklists as a next resource. Any sort of other questions, Layla?
That was it from what I can see in the chat, unless anyone's currently writing anything down.
Great stuff. Well, I actually had one, Samantha, because we're just embarking on an evaluation in a secondary school settings, and we've been looking at the sort of national data, administrative data available. But it struck me as we've been sort of speaking to practice partners about the opportunities for using maybe sort of data with sort of disciplinary procedures or other sort of data which might not be sort of reported nationally. And I wondered if that's something that your evaluation had come across, or whether there's sorts of data that you came across and thought it'd be wonderful to use this, but it just wasn't really feasible for our study.
I think there is a lot of data like that. In our case, there was a lot of data available in secondary schools as well. But for the sake of the FIRST evaluation, we just couldn't include both primary and secondary for that. There is a lot of wellbeing data out there that would be fantastic to include in this sort of evaluation, because obviously we're looking at impacts on children and teachers. So it'd be great to try and involve this sort of national level routine data collected on the health outcomes, perhaps. I think with the FIRST evaluations, you've just got to try and make it feasible in the time that you have, haven't you, to try and do it. But there's always options for kind of going back to that afterwards with the teams and look for extra sources of funding to continue the research in other ways and expand on what we found in the evaluation.
Brilliant. Thank you, Samantha. I think what we'll do now, we are going to move on to a third presenter, but before we do that, we're going to have a very short comfort break just to take us up to 3 o'clock in case anyone wants to go and grab a cup of tea. Right, so we'll get going again with the remaining half hour of the session. So we've already heard some really sort of interesting issues around some of the challenges of data, and also some of the solutions, such as the kind of the role of the peer or embedded researcher. And I'm really pleased now to hand over to Emma Coombes, who's from our FIRST LiLaC team based up in the Northwest, who's going to be talking about case studies from 2 evaluations based in Liverpool, looking at local welfare and housing retrofit schemes. And this will be exploring the ways in which data is being accessed already and is being in plans to be accessed in a new and up and coming evaluation. And I think we'll also be talking a bit, about data access and data security recommendations for people thinking about undertaking similar studies or using that data in practice. So I'll let you sort of share your slides, Emma. And again, Anne, I think, has just posted a presentation link in the chat for anyone who's having problems seeing the slides.
That's great. Thanks, Emma. So hopefully you folks can see those slides now. Okay, great. So I'm going to talk about how we're using data that are routinely collected by local authorities in the evaluation work that we're doing in FIRST LiLaC. And I'm going to start by giving a bit of background, and then I'm going to talk about 2 case studies from the city of Liverpool. So there's several reasons why we might want to use routine data. So firstly, routine data provide information on large sample sizes in a way that could not be easily accessed by other means. So for example, they can tell us about who has accessed a particular support scheme and what type of support they've received. Secondly, routine data are often good quality, as there's national frameworks and guidelines in place that prescribe what local authorities should collect as a minimum. Thirdly, an important advantage of routine data is that it might be the only source of baseline data, so it provides really vital information on what was happening before a new policy or an intervention was introduced. And fourthly, routine data can be linked to other data sources such as NHS data, and that can help us to understand how a policy or an intervention is impacting the wider healthcare system. So the most commonly used legal basis for sharing data is consent, but often this isn't applicable with routine data. So routinely collected data can also be legally shared under GDPR if the data are anonymised before they're shared. So the legal basis for sharing is listed under Article 6.1e, which is that processing is necessary for the performance of a task carried out in the public interest. So in the case of the work that FIRST teams do, public interest relates to evaluating interventions that receive public funding where there's a need to understand whether they are working as intended and how effective they are to help support decision making around future commissioning. Special category data, so that includes things like ethnic origin or data concerning health, can be accessed legally under Article 9.2j, which is that processing is necessary for archiving purposes in the public interest or scientific and historical research purposes or statistical purposes. So to be shared under GDPR, the data need to be truly anonymised, not just pseudo-anonymised. And it's always important to think carefully about whether it would be possible to identify someone from the data if it were to be linked with other data sources. And if you'd like to find out more about that, you can find full details on the website for the Information Commissioner's Office. So I'm now going to talk about 2 evaluations where we are using routinely collected data to support our work. Both evaluations are currently work in progress, so I'm not going to present any results or findings, but instead I'm just going to say a bit about what we're doing and how we're using routine data. So the first is an evaluation of welfare schemes with Liverpool City Council. So like other local authorities, Liverpool City Council deliver a suite of welfare schemes that provide financial or in-kind support to those most in need. So our evaluation is examine equity of access to welfare schemes in Liverpool. So by that, I mean whether the people who need welfare support can access it. And then we're assessing the implications of this for health inequalities. So the evaluation is looking at several different components of the Liverpool welfare system, and we're focusing on these because we're interested in welfare support that's received substantial local investment from Liverpool City Council. So by that I mean where they've added significant funds to those received from central government. And the reason we're interested in those schemes is that the council have a little bit more autonomy over how they're delivered, and they're able to tailor them to the needs of local residents. So the schemes that we're looking at include the Benefits Maximisation Service. So that's a team of specialist advisors who assess whether people are accessing all of the welfare support they're entitled to. We are also interested in discretionary housing payments. So they provide financial support for people who need extra help with rental housing costs. And then lastly, we're looking at the Liverpool Citizen Support Scheme. So that provides furniture, white goods and other essential items to people that are in need. So we've been given access to routinely collected welfare data from 2018 to 2024. And this includes information on applicants' characteristics, so things like their age, their sex, their ethnicity, and the area of residence. It also includes information on applicants' circumstances, so things like their salary, the amount of savings they have, and whether they're in receipt of any benefits. And it also includes information on whether their application for support was successful, and if so, what type of support they received. So based on the data that I've just outlined, we can provide a description who is accessing the welfare support, what types of support they're receiving. But actually, the local authority themselves are able to produce those kinds of summary statistics. So where we can really add value as an evaluation team is by linking their data to other data sources. So to produce the graph that you can see here, we've linked the council's data on the number of successful welfare applications each year to data on deprivation. And then by linking the data in this way, it helps us to begin to really understand equity of access to welfare support. So, for example, you can see from the graph here that those living in the most deprived areas of Liverpool, so that's indicated by the yellow, they're receiving the most welfare support, which is kind of what we'd hope to see, really. The data linkage is really important in terms of adding value to evaluation work, as even if the routinely collected data are good quality, then we're limited as to what we can do with it beyond describing who uses the service, unless we start linking it with other sources of data. So just to expand on that a little bit more, a benefit of data linkage is that it allows us to look at outcomes that aren't available in the original data set. So you can see two maps of Liverpool here. The one on the left shows the number of successful welfare applications per 1,000 of the population by lower super output area. So dark blue areas indicate those with a high number of applications. The map on the right shows a score for poor mental health by lower super output area. So here, areas that are dark grey indicate those with a high number of people who have poor mental health. And we've generated this score using NHS data for a number of measures that provide a proxy for poor mental health. So it includes, for example, number of GP appointments, number of A&E visits related to mental health, prescribing of antidepressants and prescribing of sleeping tablets. And what we're doing in this evaluation is linking the two data sets to look to see how changes in welfare provision, so for example, changes as a result of changes in funding, which might affect how Liverpool City Council deliver the welfare support they provide, so in terms of the number of wards they're able to make. We're looking to see how that's associated with area level mental health. So in this study, because we're linking data at the area level, so by that I mean we're linking data sets based on lower super output areas, then this allows us to look at broad patterns, but we can't infer causality. So to be able to do that, we'd need to link data at an individual level, which is something that we're hoping to do in our latest evaluation. So I'm just going to move on now to say a little bit about that. So we're also working with Liverpool City Region Combined Authority. So they go by the acronym the LCRCA, and we're working with them to evaluate their housing retrofit programme. So housing retrofit aims to improve the energy efficiency, safety and comfort of homes, and it does that via a range of measures, including adding or upgrading insulation, making repairs to roofs or windows, replacing boilers and installing solar panels. And these measures can lead to improvements in residents' mental and physical health. So the LCRCA have retrofitted more than 5,400 homes since 2021. And our valuation is examining uptake of housing retrofit support and the implications of this for use of wider healthcare services. So don't worry if you can't take in all of the detail on this slide. I've really just included it to give you a feel for the fact that the LCRCA collect really detailed data, which is absolutely fantastic from an evaluation point of view. So for every retrofit application they receive, they record the unique property reference number of the home, along with information on who lives there. The data also contains details of the property type, the type of retro work carried out, and the cost of that work, and any change in energy performance. So, as I mentioned earlier, if you want to be able to say something about causality, then you need to be able to link data at an individual level, and that's what we're planning to do in this evaluation. So we're linking the routinely collected retrofit data that we just saw a moment ago with NHS records at the household level using the unique property reference number as a shared identifier. In terms of NHS data, we're going to produce a composite annual measure for health conditions that are likely to be sensitive to changes in housing. So things like respiratory conditions, cardiovascular disease, arthritic conditions, and common mental health conditions such as depression and anxiety. We're going to look at the characteristics of those who have received housing retrofit support, and then we're going to match them to people that live in the local area who've got similar characteristics but haven't received the intervention. And that's going to allow us to create a control group. What we're then going to do is compare change in health outcomes in the intervention group to change in health outcomes in the control group. And we're going to look at those before and after retrofit implementation. So that's called a difference in difference analysis. So this work is going to be taking place over the coming year. So we look forward to sharing our findings with you in roughly a year's time. So in case you're interested in making use of routinely collected data in your own work, then I'm just going to finish with some recommendations. In terms of arranging access to data, as the previous presenters have mentioned already, it's worth starting the process early, as it can take a long time to get a data sharing agreement in place. A challenge that we face on our evaluation with Liverpool City Council is that their welfare data is stored by an external database company. So we approached that company to arrange access to the council's data, but we found that even with support from the council, it was really challenging to get access because the company, somewhat understandably, they saw this as being outside the remit of their agreed contract with the council. So a learning from that work has been where data is stored by a third party, it's really important to ensure that those who own the data are fully engaged in the process of accessing it, because that can really help ease things along. It's also important to ensure that the appropriate level of anonymisation takes place before data transfer. So, for example, replacing home postcodes with lower super output area codes. And then after you've received the data, it's important to work with the data owners to ensure that you've interpreted the variables correctly. In terms of good practice for keeping data secure, it's worth considering where the data will be stored. So we store our data on a secure server rather than keeping it on a personal laptop. You can reduce risk by only allowing those in your team that actually need access. You should also conduct a risk assessment, so something like a data impact protection assessment. And you should think about whether re-identification might be possible if combinations of variables are combined. It's important to only ask for variables you actually need, and it's also important to think about how sensitive the data that you're using are, and then to put measures in place according to that level of sensitivity. So that's all from me. Thank you very much for listening, and I'll be really pleased to answer any questions that you may have.
Great, thank you, Emma. I can see a few questions popping up on the chat, which we have some time to go to. But before that, I did want to put Chris de Soiza on this spot. I know, Chris, you're a practice partner involved with the retrofit housing study in the Liverpool combined region, and if you were able to join the discussion, whether you sort of had any reflections on using routine data from a practice partner, any particular reflections on benefits or challenges of this?
Yep, afternoon, everybody. I guess one of the main things I just wanted to add there is a lot of the rationale for these retrofit programs tends to rest on the anecdotal benefits of these kinds of programs, and we talk a lot in the team and across the sector in retrofit about the benefits of doing so and the benefits particularly to health of doing so. But I think certainly locally we don't have that evidence base to illustrate that, and by making this linkage with via the UPRNs to NHS related health data, we're really hopeful that will provide that evidence base for us. We're often in a cycle of having to bid for money and then deliver that project. And if we can say to central government, to local public bodies that, here's the evidence base for spending this money, we can make the case more strongly, I think.
That's great. Thank you, Chris. Really helpful. So I can see there. I'll just start with a couple of practical questions about access to NHS data. So I'll group a couple of them. So the first couple of questions, Emma, were how did you get access to the NHS data for research? And then a different question, were there unique identifiers used to do the linkage you talked about?
Yeah, so in terms of getting access to data, not just on this evaluation, but part of the wider programme of research that we're delivering at the University of Liverpool, we have really close links with the Integrated Care Board. And so facilities and agreements have been set up that university researchers can access NHS data. So that's sort of the framework for accessing it, the practical side of things. In terms of the UPN, that's an identifier that different organisations use. So that's a standard identifier that gives a unique reference for each home. I'm hoping I've answered the question correctly, that second one. Is that what the question was about? Oh, you're on mute, Emma.
Thanks. I'll let Jo, who posed the question, respond in the chat if she feels it, okay. Or he or she feels there's some more information needed. But thanks for that response. So scrolling down a bit, I think, as you said, there's resources available through or partnerships with Liverpool University. There's also a couple of other examples posted in the chat. I think the connected Bradford data sets through the Bradford Institute for Health Research could be a good one for people to look at as another example of where the sort of building blocks are being put in place for sharing routine data. And then there was another question, I was actually building on the one about the kind of identifiers, a question about asking if you could expand a bit on how the unique house identifier number creation was achieved and who was involved with that, and then where will that number be recorded or sit?
Yeah, so I'm not an expert on such things, but my understanding is that each house has a unique ID. So this isn't something that we're setting up as a first team. It's something that already exists, that different organisations use to manage their data at a household level.
Right. Okay. That's great. And is that store in terms of, I think, is that identifier just available then to sort of the researchers involved in the study?
Yeah, so the LCRCA, they record their data for each house level. They record the UPRN for that, and then we're able to link that. Again, that's going to be via the Integrated Care Board. They're setting up a framework in place to do data linkage on our behalf. So the NHS data is also available via that same identifier, and so that linkage will take place by a third party in a secure environment, and then we'll get the linked data back again. So that's the sort of the process for linking.
Brilliant. And then I can just see a question from sort of Alison Ferris, who's talking about the data correlations. Was asking about how you would control for other factors, assuming in terms of the other factors that might be having an influence on the outcomes of the intervention.
Yeah, absolutely. I mean, that's a really important thing. That's a really important question. So yeah, we'll be controlling for other things that can affect people's health. So we'll control, for example, around variables like deprivation and take those into account, which will help us to understand the actual effect of the intervention itself versus various confounders that might be happening in the local population that can also affect those health outcomes.
Brilliant. Thanks, Emma. And I can see Sarah Rogers, you had some additional kind of reflections if you wanted to come in.
I think Emma did a really good job at answering, actually, but I did put a paper in the chat, and yeah, we've been working on with NHS England trying to create this whole system for England, and I know Connected Bradford have done really well, and there's certain patches of excellence, but we're trying to get it working so that anyone can bring in environmental data and link it into the health records at the individual level. And in Cheshire and Merseyside at the moment, we're working on data quality checks on those data and making sure that there's a secure governance process, and we're not going to disclose anyone's identity inadvertently. So yeah, we're getting there.
Brilliant, thank you. And LiLaC, I know you've been keeping an eye on the chat as well. Is there anything that you feel hasn't been covered from the questions that have come through? There was a sudden flurry in the last few minutes.
I think you've covered them all from what I can see.
Great. So one of the questions I wanted to bring in as well, which we've perhaps touched less on in the presentations across, and not just specific for Emma, is the idea of obviously public involvement in research, and obviously with FIRST evaluations, that's something that's embedded in the research that we do across the FIRST teams. But I wondered if there are things we need to think about specifically when it comes to sort of public involvement in the use of routine data. I know sort of Jackie Cannon, you're a public contributor with the FIRST LiLaC team, so whether you sort of had any sort of reflections on that. So for example, as a qualitative researcher, I sometimes find the language of data or things like terms like big data quite confusing. So I wondered if are there specific things to do with accessibility of around public involvement, or perhaps issues of kind of trust around using routine data.
Thank you, Emma. I was just trying to get my camera working. It doesn't want to work. But yes, I absolutely agree. I think from a public involvement point of view, I think understanding the terminology that's used, I think, is absolutely key. And I think this session today, for me, listening to everybody and looking at the questions that have been posted, goes a long way to help in that situation. Still got constant learning, but today's session has been very, very useful from my point of view on helping to understand that.
Great, thank you, Jackie. And Sarah Rogers, sorry, is it some public involvement is that work that you've been doing in other programs around? Because I know you sort of work a lot with routine data in terms of thinking about how you can bring into public data champions into programs.
Yeah, so I'm working with the Northwest Secure Data Environment, which is a big NHS data challenge at the moment, and with the ARC, the Applied Research Collaboration in the Northwest Coast. So in both of those programs, we have in the former, there's kind of a diverse, shallow expertise from a number of public advisors that are being briefly brought into different projects, and then in the ARC, there's a smaller number of public advisor co-leads who help us and attend each of our care and health informatics themes within the ARC Northwest Coast. So there's different levels of involvement, but yes, and several PhD projects have focused on public involvement recently. It's been very valuable to try and work out how we can involve the public the best in this quite technically challenging topic area.
That's great. Thanks, Sarah. So if any links you have, please do sort of post those in the chat and we can sort of pick them up to share. And just as we come to the end of the session, I think Bruce Hollingsworth has very helpfully, I think, posted a really good roundup question, highlighting the real sort of practical challenges around resource and capacity at the local level. So, and perhaps Bruce, you have some thoughts on this as well, but it's aimed at any of the presenters really. So working with local data collection teams, there's been a lot about supporting and encouraging better data collection or new data collection. And given the scarcity of resources at the local level, do the presenters have any tips on how that can be supported, or to support people to make better use of data?
I think my thought was very much, Emma, that it's linked as well to an answer. Peter's given a couple of points above about scarce resources as well. I think it maybe there isn't an answer in 2 minutes, but I think it's something to be considered in terms of lack of capacity, and that capacity is not going to get any bigger in the next year or two, I don't think. So in terms of supporting research, it's sometimes not a primary objective of the people collecting the data, who are under tight deadlines and tight pressure to collect things for other means, and we're using routinely collected data. It's not collected for us usually, it's collected for other reasons. So it's just maybe some experience and thoughts, maybe getting people on board at an early stage, keeping them on board, seeing how research can actually be a cost-effective means to help them with their policy making and decision making and service delivery. Convincing people to be on board with you when they've got 101 other pressures and very tight finances as well.
Thanks, Bruce.
So I was just going to say, I completely agree with Bruce with that as well. And I think with the larger data sets that are available, such as the Scottish Government stuff, I think the resources just aren't available to make that happen or clean the data in that way. But I think it's with the charity stuff or the local authority data where perhaps if it's starting from new, and you can just make sure that if this data is being collected from scratch, or you're thinking of starting to collect routine data, really try and have these considerations then about sort of data management, consistency, and imagine coming back in a few years' time and trying to work with this data. Just work with what you've got, allow the time to work with it. But if you are starting a new level of routine data collection, really try and consider these various things.
Can I add?
Of course, Sarah.
So I would recommend that at least templates are handed out to everybody, because I've tried to work with alcohol outlet data which are collected from a national mandate before, but they're collected locally and there wasn't a template. So we found that the 22 local authorities in Wales collected the data in 22 different ways, and it was quite as Sam found with the education data, it was really difficult to wrangle it in a format where you had a national data set that you could work with. So I think if you're going to have nationally mandated data, have a template and then have a process and maybe of training how to complete that as well with the metadata, so that everyone has a good chance of completing it in the same way.
That's great. Abby, I can see your hand up. Unfortunately, we can't. I think because the microphones are muted. But if there's a question you want to pose, do pop it in the chat, and maybe that somebody can sort of pick up on that after the seminar, because we're just about to sort of bring things to a close now. I can also see some really kind of useful reflections around public involvement in the chat as well, and actually just going back to some basics around how are we defining routine data as well in the first place, and what constitutes that. But as we're approaching 3:30 now, so we'll bring the seminar to an end. So I'd really like to thank the presenters again. Thanks so much for the really interesting presentations and for engaging with all the questions. And also to thank Anne Fitchett and the comms manager for PHIRST, and John and Layla from the LiLaC team for all the help in arranging this seminar. So please do sign up to the newsletter or follow social media just to find out about the latest calls for local authorities or other local government organisations to submit expressions of interest to the PHIRST scheme, or just to find out about future seminars as well. So on that note, we'll bring the seminar to a close. Thanks very much.